Good evening, everybody. And today we are trying to probe into the predicament of trans men during the COVID-19 pandemonium. Me, as a cisgendered man, I don't think I'm in a position to talk about trans men at all because I can, at the most, be sympathetic towards them. I cannot be empathetic. That is not possible. I mean, I am not going through what they are going through, and uh, my sympathies, my association, my affinity towards the community of sexual minorities is all that I have. I don't think I am quite qualified to talk about this, but nonetheless, as was requested by the dialogue to do this interview, I would try and throw light, a bit of a light on the problems, the issues which trans men may be facing at this hour. To begin with, let me point out that um, in my research on queer theory, my research on LGBT identity politics, I have noticed, and those who have been into this field of research, they must have noticed that trans men are fiercely underrepresented. And there have been times when, they have been invisibilized to such an extent that in many of these works on queer studies, it appears that they do not exist. So, in fact, during my current research, looking at the global scenario of LGBT people and the plight during this uh, unprecedented, unforeseen pandemic. I'm sorry, pandemic, which is of course, I mean, becoming a pandemonium, rather, I should say, in this pandemic. I was rather surprised that they were terribly underrepresented in the various news articles which have come out on the plight of LGBT people. I guess I came across only two articles where there is some mention, one or two mention of trans men. One of them was by the BBC, and there they have interviewed a trans man from Kenya, and that's interesting. And he's from rural Kenya. He stays like 350 kilometers away from the city, and because of the lockdown, he has run out of his testosterone supplies, and it is impossible for him to travel all the way to get it. And also he says, and also many others, I'm sure, would also kind of concede to this, that you cannot just walk into a drugstore and buy hormones, right? That's not possible. It requires a prescription, of course. I assume there is a prescription, but also the point is that the prescription in most of these cases needs to be renewed. So you cannot use one prescription twice, thrice, or four times to get the same hormone that you need. The prescription needs to be renewed, and the date has to be nearer to the time that you are visiting the drugstore to get it, or wherever you're going to get it. Now, because of the health emergency situation, this kind of treatment, like which is related to this transitioning process, has been completely rendered non-essential, and it has been totally sidelined. And I understand why it has been sidelined, because most hospitals, and because healthcare system across the world is now, it now appears that they were not ready for this kind of a pandemic. So of course, there is an emergency, and therefore people who are transitioning are not will not be kind of treated with that amount of importance as it used to be earlier, perhaps not so much. So one huge problem which trans men would be facing, and I'm sure they're already facing, is getting a regular supply of the hormones hormone therapy they are taking. uh, Second and most important, I believe, is that whoever undergoes this transition, it is not just about taking some external stimulus into your body and then initiating the process of transition. It also requires regular therapy. right? Regular therapy, understanding, talking to people who understand you and also your state of mind, and it requires a constant attention from a therapist, and not just therapists. I believe it is also very important to stay in touch with your community, and when by remaining touch, I mean physical touch. You meet them, you talk to them, you share your views with them, you share your misgivings with them, your agony with them. I know in this world of social media and all of that, the community is always perhaps available online, but I don't think it is easy. It is, I mean, meeting the community online is as is as fulfilling as meeting them in person. So given the lockdown and given the situation, it is difficult to connect with the community at this moment. So that is one issue. Therapy, the alienation from community, and also the difficulty of obtaining hormones at this moment, if it is necessary. I was reading an article from the US where a group of trans men and women, they say that this is a practice in the community, that they do share hormones when it is difficult to get prescriptions renewed. Now, because of the mandatory lockdown, because of the stay-at-home mandate which has happened, meeting and giving the hormone, if you have one, for example, X has a supply of hormone, but to transfer that to Y requires a physical travel from one place to the other. That is not possible at this moment. So the practice of sharing hormones is, it's there, and it's how community people protect each other. Community people share, and literally they share it, and it is sometimes necessary when you do not get a hold of a renewed prescription. At this moment it is also not possible. Third and most important, in our country, as far as I know, many trans men are working in unorganized sectors. They are daily wage earners in many cases. They do not, many of them, in fact, most of them, are not part of organized sectors, and therefore they have been very badly hit, terribly hit, because we are talking about daily wage earners, we are talking about migrant workers, but I believe within that bracket many trans men would also fall, and I'm sure they are going through a terrible economic crisis at this moment, and given the kind of situation the pandemic has thrust us into, this economy is going nowhere. I mean, what we have in front of us is a great economic depression, if I can put it that way. So I really do not know whether conditions would improve. It is very difficult to speculate. So when we talk about daily wage earners, I believe we need to talk about how many of these trans men have been affected. And why do we need to talk about trans men in this situation is because trans men, if quote unquote discovered to be trans men, are bullied, are shamed, are kind of bashed in unspeakable ways within the workplace. So, first of all, to getting a job is very difficult, and during this time, the possibility of losing the job is also very high. So, going back to work, or retaining the job, or maybe kind of, you know, getting a new job. So many new challenges have emerged during this time. This will be true of everybody, but I believe that, as I just said, that trans men have been very badly hit that way. Uh, Another thing is that, is there no solution to this? Of course, it's very difficult to predict a solution, like a pandemic of this scale, which is affecting so many of us across the globe. We are nowhere to give any solution to anything. But I think at this moment, one possible way of keeping your sanity in place, keeping keeping your mind, keeping your peace of mind. One way of doing this is to stay in touch with the community people, talking to them, sharing with them. You know, meeting is impossible, of course, but video calls, if possible, I don't know. So, constant sharing, constant And also, I believe that although today I am talking about trans men without that kind of a subjective experience, or not being one from the community, I think more stories should come out from trans men, because the number of stories which come out, it will not these stories will have similarities, but these stories would also have their own individual uniqueness, and these unique stories should, find way into the internet, into the research arena, and people should know more stories, and there is a lack of stories from trans men at this moment. So more stories should come out, because the number of stories you hear, you also get to realize that what needs to be done, what are the possible ways of negotiating with a situation which was totally unforeseen. Also, uh, as I would like to end this interview by saying that within a queer feminist space, as I began this interview with saying this, that trans men are terribly underrepresented in the discourse of queer studies. So it is it is possibly because that within a queer feminine space, women approximating the male gender may sometimes be looked upon or perceived as appropriating the more powerful male gender, and therefore approximating or appropriating, I would rather say, the heteropatriarchal celebration of manhood as superior. You know what I mean? So that way, the position of trans men, even within within the field of LGBT politics, is a little is a little wobbly. It's not so solid. So there is a bit of suspicion there, because it appears, theoretically speaking, it appears that a kind of heteropatriarchal notion is being appropriated by adapting to a certain sex which has been looked upon as the perpetrator. So, that's why perhaps this invisibilization, that's why a lot of, I would say, hesitation to talk about trans men in various forums. But I believe trans men too have organized themselves in a very, very remarkable way. They have all come together, and I'm sure that this pandemic, where we have been isolated from each other, this might also be a time when we can actually reach out to each other, where every person of the LGBT community, it's time that they should reach out to each other, reconnect, try and understand that how badly they were already oppressed, and how this pandemic is also again throwing them into a more marginalized position. So everyone needs to come together and talk about the idea of articulating your stories is very important. I would suggest that websites, e-platforms, wherever is possible, I would urge trans men to come out and tell their stories, because the more you share, the more your stories are out there, I believe it would be easier for you to consolidate your identity, and also project to the world that what actually is plaguing you, and your stories need to be told more. Anyway, I believe I've been able to make sense of what I was trying to say, but again, I would say that I'm certainly not in a position to talk about trans men in a very meaningful way, and I, I don't know whether I could make justice to what I just said, but I hope that this video raises some bit of awareness, and I would look forward to see many more stories which are coming directly from trans men, and not through the medium of people like us. It should come directly through them. I end this interview with that sort of desire, that wish. Thank you so much.